Hey guys, so today I want to talk about anxiety. As you may have noticed, we are going through a global pandemic, which alone is going to cause a lot of stress and anxiety. Now, I don't know about you, but I experienced it myself working in the emergency room while we're going through the heat of COVID. It created a lot of feelings and emotions, and they turned into symptoms such as chest pain. And this is something that I want to talk about today as far as what is anxiety-related chest pain and how do we tell the difference between anxiety chest pain or actual cardiac event chest pain, just like a heart attack. So let's talk about, first of all, anxiety and what's happening at a biochemical level. So anxiety is essentially just a sensation of fear that you're thinking of something that's happening and you're overstressing about it. What's happening inside is that there's a chemical response at the neurological level where your sympathetic nervous system, that's your fight or flight, is heightened. And a lot of the times it can remain and stay at a heightened level for a long period of time. Now, anxiety and chest pain, that's where those symptoms start occurring. So if you can think about it, when you are stressed out about something, if you keep worrying about things and you just don't know the answer, do you experience symptoms? Do you shake? Do you freeze up? Do you get chest pain? Do you get short of breath? All of those things can play into because your nervous system is just at a heightened level. So, how do we determine between anxiety, chest pain, or do we need to go to the ER to get checked out? Well, the first things first is look at your risk factors. So things that I look at when patients come to me for chest pain is, they have a history of coronary artery disease? Do they have a history of hypertension, diabetes, if they had a heart attack in the past, what their age, and if there's a strong family history. That's going to give me a good sense of if this truly is something I need to continue to work up, or is this related to something else. Another thing is looking at the history. So what is causing this chest pain? Is it after argument? Is it after you've been mentally stressing out? For me, sometimes, especially during COVID, talking about COVID for other people, it would start inducing this chest pain. And I realized that it was stress-based and anxiety-based. So what do you do about it? First things first, stop what you're doing. Start taking some deep breaths in, because why? Remember, this is a heightened sensitivity to your sympathetic system, so you want to calm that down or upregulate your nervous parasympathetic system. And one way you can do that by yourself is through breathing. So you're going to take a nice long inhale, let's say 3 seconds, and then exhale, mouth open for double the amount, so 6 seconds. And do that multiple times and see if that chest pain goes away. The reason why I focus on doubling the exhalation, because that's when it starts tapping into your parasympathetic nervous system. So go ahead and try it out. If that doesn't happen, or if you're having those risk factors that I explained, go to the ER, go to your doctor to get an EKG, potentially some blood work and a chest x-ray, just to make sure that this is nothing more than just an anxiety chest pain. So hopefully this helps determine a little bit of things. I know that a lot of people have been having chest pain and anxiety related complaints that I've been seeing in the emergency room, and all of their workup was normal and it was just the anxiety. So hopefully this helps determine a few things. Thanks guys for listening. Until next time.